Hi, everyone. Thank you for hanging with us for some technical difficulties. Thank you for joining us for today's webinar, Mental Health Policy in the 2025-26 New York State Budget. Just going to touch on a few logistics quickly, and then I'll introduce the webinar and our speaker a little bit more. So today's webinar will be recorded, and the materials and the recording will be made available early next week. At the end of the webinar, you will get a brief survey that will show up in your browser. So please just take a minute to let us know your thoughts and share any topics that you would like to see us cover for future webinars. As an accessibility accommodation for screen readers, the chat is disabled. So please use the Q&A box to ask any questions, and we'll set aside some time at the end of the webinar to make sure we have time for that. So now for the webinar topic. As part of this year's executive budget, the governor put forward proposals related to involuntary commitment. This has been a focus in the last two budgets due to several tragic events, particularly in New York City, despite lack of evidence that forced treatment works. The legislature rejected these proposals in their one-house budgets, but this became one of the controversial policy issues that held up the budget for several weeks, with the governor's office insisting on seeing changes as part of the final budget agreement. So our webinar today is presented by the Alliance for Rights and Recovery, who has helped to lead the charge against forced treatment and instead advocate for the rights of people with mental health disabilities and for increased funding for services that have proven to work, that are community-based, and that are voluntary. Many of you know Harvey Rosenthal, the executive director of the Alliance, who was supposed to be with us today, but can't make it. But he's been a longtime ally and friend of independent living. So today we're joined by Luke Sikinyi, who's the vice president of public policy at the Alliance. Luke is someone who you see his face in the halls of the Capitol on a daily basis. So he is in Albany fighting the fight on these issues on a daily basis. Luke is going to walk us through what happened in this year's budget, as well as next steps for advocacy and ways that we can help support people with mental health disabilities and the Alliance in their efforts. So thank you, Luke, for being with us.
Thank you, Lindsay, and thank you all for being here today and all the work that you've done to really advocate on behalf of folks with disabilities. I know we've had a really strong partnership, and throughout the budget fight, we had a number of folks from the independent living communities come out and support our efforts. We came out as well to support you all. So really want to just thank you all for that partnership, and hope to see it strengthen and continue as we face some really big challenges over the next couple of years. I'm going to take you all through what happened in this year's budget, starting with the executive budget, like Lindsay mentioned, and some of the provisions in the governor's proposals, and then walk you through what we did, and then get to the final sort of budget and end by just talking a little bit about what we can do going forward. So without further ado, I will go ahead and get started. All right, can everybody see my screen? All right, great. So as Lindsay mentioned, Harvey Rosenthal, our CEO, was hoping to be here, but unfortunately he's not feeling well, but he sends his best to you all, and he knows he has expressed how great the partnership between our communities has really been, and the overlap that we have, and wanted to be here very much to speak with you all. But I will try to do my best to offer you all as much good information in his stead as possible. But I'm Luke Sikinyi. I'm the Vice President of Public Policy here at the Alliance for Rights and Recovery. I'm also someone in mental health recovery myself. So I come to this with lived experience, and that's part of the reason why we do a lot of this work, is the passion of understanding what it's like to go through this, and also understanding how important it is for us to advocate for ourselves, but also on behalf of others who don't have the opportunity to be up in Albany and speak with legislators or really make changes to the policies that affect our structures that allow us to recover. Here you can see some of our wonderful actions. First, with our in the top left corner is us at our legislative day in the egg, where we have hundreds of people join to speak to legislators, hold events, and really talk about what policies need to change and advocate for new funding each year. On the right, you can see us meeting with legislators directly. And then on the bottom left, you can see our wonderful board member, Teresa Hall, who is running a rally outside of the Capitol. This one was specific for workforce and housing and other services. And then you see some of the other work that we do, including press conferences with legislators on the bottom right here. But let's get into it. So this year, the governor really began, while her proposed budget spoke about, focusing on mental health. The major focus in this budget was really on involuntary commitment. So the executive pushed to implement a new statute to expand involuntary treatment. They asked for expanding the criteria for what people could be involuntarily removed and sent to hospitals for involuntary commitment. The former standard was danger to self or others, which really meant that you had to pose an immediate risk of either suicide or threatening to harm other folks. But they wanted to change that to include the inability to take care of one's food, shelter, clothing, and medical needs as a reason to pick people up off the street and take them into the hospital. They also called for the addition of psychiatric nurse practitioners as some of the professionals who can evaluate people for involuntary commitment. Prior to this budget, it was physicians would have to make that determination and agree that you need to be involuntarily committed. But just to skip ahead a little bit, they were asking for a nurse practitioner to be one of those two individuals who can call for it as a way to ease the process for hospitals and other localities. They also called for an expansion of Kendra's Law, which is our involuntary outpatient commitment law. They wanted to make it easier to access patient records without an individual's consent. Adding a domestic partner as someone who could request a Kendra's Law order for someone, allowing clinicians to appear at hearings via video conferencing, so it made it harder to fight the order, and then making it easier to put people back on orders without due process, so without the court hearing, if someone is within 6 months of the expiration of a previous order. So we at the Alliance have consistently fought against involuntary commitment and forced treatment in all forms, and this year was no different. We were incredibly concerned with the calls for increasing involuntary commitment, and we urged the state to reject expansions of involuntary commitment and instead focus on improving coordination of services and implement incident review panels to promptly review critical incidents, identify gaps, and provide recommendations. The incident review panels was one of the big pieces that we pushed for as a way for us to really address the serious incidents of harm that have been happening that really push this narrative. I think the thing to really think about here is that this really happened in an environment of fear, partly because of some really horrendous actions in New York City, in the subways and on the streets where folks were killed or grievously harmed, either individuals who had mental health issues and were experiencing homelessness were harmed, or they were the perpetrators of it. But we know that less than 4% of any violence in the nation is perpetrated by people with mental illnesses, and rather we are more likely to be 11 times more likely to be the victims of crime and violence than the perpetrators. But yet the media has really scapegoated our population, particularly folks with mental illnesses who are experiencing homelessness, for the rise in violence. So politicians felt pushed and felt like they needed to do something and do something quickly. So incident review panels was one way that we really saw an effective way to evaluate what actually happened during this critical incident, what led this person there, and what we can do to stop this from happening before. Noticed with a lot of these incidents is that many people who were involved in them had been looking for services but were unable to access them. Either they had been in the hospital or were trying to get some form of support. We always think of Jordan Neely, who died at the hands of another bystander in the subway after he'd been, calling for help with food, shelter, and clothing. Jordan had been in a number of programs, but none of them had been consistent or coordinated. And he was really left just asking for support, but we weren't able to provide it to him because of gaps in the system. So that's part of the reason we really want incident review panels is to really identify those gaps and identify ways to fix those gaps. We also pushed for increased funding for continuing effective voluntary services, some of which the governor outlined in her executive budget, but with far less emphasis than she did with the involuntary commitment piece. So some of our priorities going into this year's budget, inset teams, which are intensive and sustained engagement teams. This is a program that is currently operating. There are 4 inset teams, actually now 5 inset teams operating, one of which is specific for forensics or people who are leaving criminal justice facilities. The governor in her executive budget proposed funding to expand inset teams by providing another 2 to 3 teams, while the assembly in their one house budget put up an additional 2 more inset teams. So we called for an additional 5 teams to double the number of teams in the state, so more localities can have access to this. Inset was created really as an alternative to Kendra's Law or AOT. It is a voluntary alternative led by peers, people with lived experience of mental health challenges, and it really focuses in on consistent engagement. So rather than forcing people into services, you really go out to people where they are, whether that's in the street, coming out of hospitals, coming out of jails or prisons, and you really talk with them about what it is that they need, what's their immediate needs, and you develop a relationship to address those immediate needs and then begin considering what we can do to address your mental health challenges. We're really happy to see that the state has, funded these programs, but there are nowhere near enough of them for folks throughout the state to get benefits here. We also push for clubhouse expansion. Clubhouses are non-clinical psychosocial programs that really create a family-like environment where people can come in whenever they want, get services, get socialization, and get support with things like employment and education, so that they can really achieve their goals. But what's really great about this is, there's no real hierarchy within the clubhouse program. The goal is to really create more confidence for folks and self-sufficiency while dealing with your mental health challenges. We were really excited to see the governor include $8.5 million for new clubhouses outside of New York City in this year's executive budget. While New York has, I think, over 10 clubhouses, New York City has over 10 clubhouses. We've seen the majority of clubhouses in upstate areas close after funding was switched to a new program. So this is the first time that the state will begin to fund upstate clubhouses at a large level in probably over a decade. So we're really excited about that and continue to push for it. We also push for peer bridgers in community hospitals. Peer bridgers are folks who meet people upon admission to hospitalization, work with them throughout their hospital stay, and then work with them up to 9 months after they have been discharged. And the goal is to really help get you back into the community, to coach life skills for folks as they re-enter their communities of choice and help them get whatever it is that they need to maintain their recovery and stay out of the hospital. So the governor included $2 million for peer bridger pilots in her executive budget, while the assembly added an extra $900,000 for 2 additional teams in their one house budget. Lastly, we called for enhanced voluntary services. So the governor added 16.5 million for counties in her executive budget. And the goal of this was to allow counties to either use this for Kendra's law orders and programs associated with that, or enhanced voluntary services. Enhanced voluntary services are a package of services that are offered to people who would otherwise be considered for Kendra's law orders. This can be things like housing, case management, or ACT teams, and other needed services that prevent people from going into the hospital. What we've seen since the enactment of Kendra's law in 1999 is that a lot of upstate counties utilize enhanced voluntary services rather than the court orders. But we've seen that begin to shift a little bit with counties having less money for services. So we really push for this 16.5 million to go for services and specifically voluntary services rather than staff to process more commitment orders. We also push for housing and housing first in particular. So in consultation with a group of housing advocates, we called for ESHI rates, or the Empire State Supportive Housing Initiative rates, to go from 25,000 per unit to 34,000 per unit across the state, because housing providers have said that the current rate is far too low to address rising costs and provide people with additional services. We also called for an additional 15 million for ACT teams to go along with new housing units to allow for true housing first model programs. Housing first is a program in which people who are experiencing homelessness get access to housing without having to jump through any hoops. There is no qualification necessary other than the fact that you need housing. And it's low barrier, which means that people don't have to go through a treatment program or stop using substances in order to get in to the housing. The goal is to get people housing first and then support them with their other challenges, like mental health or substance use issues, and also to support them to become more self-sufficient, like things like helping with education supports and employment, so that they can have that sense of dignity and continue to upkeep their apartment. But one of the biggest pieces about this is for folks who are in housing first, that apartment is theirs. They signed the lease. They are responsible for the upkeep of the apartment. And it means that it's permanent, so that people don't have to worry about transitioning to another location once they're settled. We also push for Daniel's Law mental health crisis response teams. These are teams modeled after the CAHOOTS model of crisis response, which would utilize a EMT, a peer, and other mental health expert to respond to people who are experiencing a crisis, substance use or mental health in the community. Right now, our state really responds to crises with police the majority of time, while some areas have mobile crisis teams that go out. Most of the time, if you are in a crisis in New York State, you will receive police response, and that leads to a lot of really negative outcomes for folks. And we wanted to change that through Daniel's Law, which is named after Daniel Prude, who died at the hands of police in Rochester back in 2020. And we were really excited to see that the Assembly and Senate One House budgets included 22 million for Daniel's Law teams and a behavioral health crisis technical assistance center, which would be housed in OMH, to really expand our crisis response to include more non-police responders. So around agency and workforce funding, the governor proposed a 2.1% rate enhancement, or an inflationary increase for human services agencies. And we are really disappointed to see it was just 2.1%, partly because the inflationary index for the year was 2.9%. So only getting a 2.1% enhancement would essentially be a 0.8% cut for many agencies who are really struggling and overburdened with the number or the amount of requests for services, but also because we are really struggling to maintain our workforce. So we, along with a coalition of statewide advocates, pushed the state to provide a 7.8 rate enhancement in the final budget. And we really thank the independent living community because you all came out to support us in these calls. And we were out at the Capitol basically every day throughout the session, really pushing legislature to include a 7.8% rate enhancement. And while both one House budgets did include 7.8%, the final budget was much lower than that. So, as Lindsay mentioned, the issue around involuntary commitment really held up the budget. So, we were proud to see that our work as advocates had a significant effect on the budget process. The campaign that we worked with disability rights lawyers, um, independent living centers, uh, housing advocates, community service providers, and peer advocates. We had a host of people really join us in this sort of cross disability advocacy campaign. And push against involuntary commitment, and it really became very contentious. So the state legislature, in their one House budgets, their rebuttals to the governor's executive budget proposal, they both rejected calls for involuntary commitment expansion and included additional funding for key programs, like I mentioned before, like inset, peer bridgers, and ACT teams. And through our work, we really were able to educate the legislature as well as some of the media to the harms of expanding involuntary treatment instead of the voluntary alternatives. But I really want to say that the governor really dug her heels in and would not listen to anything else until she got her way with a lot of these provisions, particularly the involuntary commitment provisions that she proposed. So through our campaign, we held multiple press conferences that featured mental health, independent living, disability rights, criminal justice reform leaders, along with peers, family members, and faith leaders. And we even had one press conference with former police officers who really called for voluntary approaches rather than involuntary because they didn't want to be the people to involuntarily pick people up off the street and take them to hospitals in the back of cruisers, handcuffed. We also utilized online mailing campaigns, handed out daily flyers, and regularly met with the executive chamber, the governor's office, and key legislative leaders throughout the session to really push against this. We worked with our legislative champions, lobbyists, and coalitions to get media coverage and move legislators to push for more voluntary services rather than the involuntary commitment standard expansion. And we were able to get some pretty great press coverage through our press conferences. We had op-eds in Times Union. We were quoted in print like Politico, the New York Times, Times Union as well, the Gothamist, City and State, TV and radio coverage. And this was all throughout a 4-month process. But it was a really, truly grueling process, but we got up every day really trying to fight this to ensure that the rights of our folks were protected and that we did not go silently as these pushes were put forward. So what actually happened in the final budget that was passed about 2 weeks ago? So we're going to talk a little bit about the enacted budget provisions. So our work had a significant effect on the budget process. It was one of the main reasons why the budget was so late this year. I think it was us, discovery laws, and issues around the mask ban. But this became a really contentious point with legislators calling out the governor in media and during their talks. But the governor really, doubling down every time she could. When the governor would hold a press conference, and we would hold a press conference. We would then hold a press conference the next week, and the governor would do something. So we really went toe to toe with the governor, really pushing against this for as long as possible. And while we were able to educate a lot of members and get them to understand the position, the governor just holds quite a lot of power in the process of the budget. The legislators can either vote no or yes to things, and the governor gets the final sign off on whether the budget will pass or not. And she wouldn't allow this budget to pass without getting what she wanted in a number of areas but one of her top priorities, her top three priorities, was the involuntary commitment expansion. So unfortunately, we did lose this battle. So the budget included most of what the governor wanted to expand involuntary commitment, including the gravely disabled standard being put into statute. And that's a standard that allows for police to evaluate individuals and assess whether they have a mental illness and are unable to meet basic needs like food, shelter, and clothing due to their mental illness. So because of this, police are now able to make that evaluation and then transport people against their will to hospitals for involuntary hospitalization. The legislature was able to include the use of EMS for transport rather than police, if practicable. Those are the exact words used there. And this was, while we welcomed the use of EMS instead of police because it's a little bit less traumatizing, we also understand the limitations of our state. A lot of areas don't have adequate EMS personnel to be able to make these transports. So it means that most of the time it'll still be police doing the transports. Police will be able to have make these assessments. And we just think that is incredibly the wrong way to go. We should be reducing our reliance on police, not increasing it. And police are not trained as clinicians or folks with extensive mental health um, training or understanding. So they shouldn't be the ones to make these assessments. And they very much should not be handcuffing people, taking them off the street, disrupting their lives, and taking them to hospitals, because this is incredibly traumatizing for folks. And these are actually termed mental health arrests within the statutory language, which is really concerning because it does really feel like an arrest. So we've essentially criminalized and medicalized poverty because people can't maintain their food, shelter, and clothing. But most folks who are struggling with housing, food, and clothing, it's not because of their mental illness, but rather because of economic issues and the high cost of housing and inability to access social services that would provide them with food and clothing and shelter. And we know that hospitals are not the best place to get food, shelter, and clothing, especially long term. So this is a really concerning change in the way that our state deals with mental illnesses and folks who are on the street. And it felt very politicized because of the push from media as well as calls from advocates for involuntary commitment. This was truly just a political game here, and we're just really concerned with how this is going to affect people. We know that we should not be choosing between protecting people's rights and making people safer. We can do both by increasing investments in voluntary services so that everyone has access to them. The budget also allows for psychiatric nurse practitioner and a physician to sign off on involuntary commitment determinations rather than two physicians. So it makes it easier for hospitals to to involuntarily commit people, even if they don't have the physicians available to make those assessments. Around Kendra's Law or AOT, some of the changes included one that was really concerning, which is allowing people to be automatically placed back on an order without a court hearing or the chance to object to the new order if they are within 6 months of the expiration of a previous order. So this really shows the lack of consideration for individuals' rights and the push to place people on surveillance and confinement, even in outpatient settings, without really considering what's best for them or allowing them the opportunity to object. The budget also gave $2 million to OMH to hire more staff to process Kendra's Law orders. And this is $2 million that could have gone to the community to provide more services, but rather is just going to staff to create more involuntary commitment. Lastly, as I mentioned before, the budget directs $16 million to the counties for either enhanced voluntary services or can result orders. And we're advocating now and have been, but especially now as we get to implementation, we're advocating for this funding to go directly to services to increase access on a voluntary basis rather than more county staff to process more orders, because we see this as the wrong way to go for our mental health system. So we spoke a little bit about incident review panels and the importance of these. Just to give you a little bit more background, incident review panels were enacted and put into legislation back in 2014. This happened after a city and state panel back in 2008 convened. And around that time, there were similar challenges with a lot of incidents of violence happening that were high profile. And the city and state got together to create some recommendations on how we can prevent this from happening. So they recommended more coordination of services and evaluation, but they also recommended incident review panels. So these panels are multi-agency and include state and local officials, mental health providers, hospitals, and police agencies. And whenever a critical incident occurs, they are able to convene, determine what actually happened, what led to that critical incident, what gaps in the system allowed this individual to be in this kind of critical incident. And to be clear, these incidents are either committed by someone with a mental health issue or the individual with a mental health issue is the victim of one of these incidents. But the goal of this was to really understand what happened and then provide recommendations to the state and the public for how to fix this going forward. So although this law was enacted in 2014, because of the way it was written, it gave discretion to the Office of Mental Health on whether or not to actually utilize them. And unfortunately, in the 11 years since it has been enacted, OMH has not done a single public incident review panel. And we thought that was just wholly wrong. So one of our pushes was to mandate the use of these panels so that we can get these done anytime a critical incident occurs. The budget didn't go as far as what we had advocated for, but it did mandate the use of incident review panels. And now OMH will be required to do a minimum of one panel convening per quarter, so at least for a year, and to review, they can review multiple incidents in each panel, and then create recommendations that they can send to providers, which are confidential, but also if they're required to issue a cumulative report to the governor, legislature, and public every 2 years. We were really disappointed by the fact that it's only every 2 years rather than once a year or after every incident review panel. So we're continuing to advocate with OMH during the implementation phase to convene more than 4 a year and release relevant recommendations more often than once every 2 years so that we can increase accountability and transparency and also just fix the system. I think, the thing to think about here is that without that transparency, without giving the legislature the recommendations for how to change this, then the legislature is really left guessing what needs to change. But our state needs to have clear recommendations on what should change so that the legislature and the governor can utilize limited funding and also their time to really address the critical gaps in services and improve our system overall. So around crisis services funding and Daniel's Law, we were really excited. This was one of the bright spots of the budget. The budget included $2 million for the Behavioral Health Crisis Technical Assistance Center, or the BHTAC. And this will create regulations for when to send non-police responders, help create trainings for crisis response and dispatch providers, and then support localities to expand and create non-police responses while helping to integrate 988 and other call lines for crisis with 911. So that no matter what number you call in New York, you can receive a non-police crisis responder. And really with Daniel's Law and the non-police crisis response, these we want them to go out to any situation where an individual is experiencing a crisis, but there is no weapon or threat of violence involved. If there isn't a report of violence or a weapon, then police should not be going out, and we should have teams that don't have police on them and are led by peers and other health experts to respond. And we are really happy to see that the budget included 6 million for these new non-police crisis response programs that are modeled after the Daniels Law legislation. So while we were hoping for 20 million for these teams, 6 million is a decent start, and we will continue to advocate in the development of the request for proposals or the RFPs for these programs and the setting up of the BH TAC in the coming months. But we want to make sure that peer-led programs get these funds to provide those responses that are modeled after Daniels Law's goals and to ensure that the right sort of providers and right sort of responders are going out to people whenever there is a crisis being experienced. This was really for us the first phase of the process. We're still pushing for the full Daniels Law legislation to be enacted either this year or next year, and for statewide expansion of these programs. But this is a good sort of phase one starting point, but we know much more is needed. One of the things that the legislature was able to negotiate with the governor was to improve discharge requirements for individuals leaving hospital stays. So the new requirements include direct connection with existing community providers who may already be working with the individual who's hospitalized. So letting them know when someone enters the hospital, also letting them know when someone's about to be discharged so that they can set up the appropriate post-discharge services and continue to work with the individual to prevent them from going back to the hospital. The new requirements also include a mandate for a follow-up appointment within 7 days, which is huge because many people leave the hospital without any follow-up services. And we really wanted to change that this year. No matter whether you were hospitalized voluntarily or involuntarily, people need a quality discharge in order to remain out of the hospital. And finally, it also included peer support and community providers in the discharge services. So people will now be referred and connected to peer coaches and peer mentors to help them regain skills and navigate the system after they're discharged, as well as direct connection with community providers if they don't already have that connection. However, we were disappointed that these requirements were only for folks who were admitted to inpatient psychiatric hospitalization. So those folks who go to the emergency room in crisis but aren't admitted still don't have any requirements for post-discharge support. They may get a referral, but it doesn't guarantee those appointments or connection to community-based providers, which is an area that we need to continue to improve. And just as concerning, the statute fails to include people being released from correctional facilities or the criminal justice system, and they still face serious mental health challenges and barriers to effective services and stability. So going forward, we'll be advocating for these for folks who are coming out of these correctional facilities to get similar requirements for discharge services. And there are a number of bills in the legislature, even this session, that really aim to do so, and we're advocating for those to be enacted in a way that really supports people with mental health challenges. So workforce investments. As we mentioned before, we called for that 7.8% flexible rate enhancement. Unfortunately, the final increase was only 2.6%, which is incredibly disappointing because this really shows the lack of support for community-based providers who are really the backbone of the mental health system in New York, as well as the substance use system and other human services agencies. And while our advocacy did lead to a 0.5% increase over what the governor originally proposed, this is still woefully low and does not do anywhere near enough to um, make right the lack of investment over the last 20 years in our system. So we will continue to advocate for greater workforce and agency investments so we can pay our workers a living wage and meet rising demands for services because we truly are the backbone of the mental health and substance use system, and we need to really make investments that show that this is a area of priority for the state. And this year we just did not do so. This is one of the biggest disappointments of this year's budget. But I want to talk a little bit about supportive housing. So there was some funding for supportive housing, but once again, nowhere near enough. There's 11.9 million for scattered site supportive housing, but this is just a property pass through so that when rents go up, OMH will pay for these increases based on HUD fair market price. And this does not affect New York City programs, which are particularly struggling because New York City rents have gone up so much. But this is added money for folks who are currently running programs, but it's not for new programming. We also got 1.4 million for an aging in place program. This will pay for 5 pilots in existing community SRO programs. So it's about 300,000 per program for additional services like nursing services, OTAs, and home health aides. While we are happy about this, and we hope that this demonstrates the effectiveness of aging in place programs so that people don't have to leave their residence and go to nursing home facilities, but rather can remain in the place that they've lived in for years and get wraparound services to help them maintain their housing. Budget also included a promise for new eSHI units, which they expect to affect about 2,800 to 3,000 units. And the promise is to get a rate increase from 2,500 a year to 34,000 for New York City programs and 31,000 for the rest of the state. This will not affect current eSHI programs, which are already up and running, which is incredibly disappointing because they are struggling to meet the rising costs of housing. And we had really advocated for this to go across the board for eSHI programs. The second part of this is I want to make clear that this is a promise for the increases. There is no actual money included in here. And part of that is because through the eSHI program, you have to provide capital and find and build new housing programs. So they're expecting these dollars to come out in later budgets. So maybe next year's budget or the budget following next year, as it takes a number of years to bring up these housing programs that have to be built from scratch. Lastly, there was 25 million for the homeless housing assistance program, which we really appreciated. This is a program that is specific to folks who are dealing with homelessness and might have a mental illness. But this means there's going to be more money to get people off the street and into housing rather than just sending them to a hospital where they will likely be discharged back to the street or a shelter, which does nothing to really effectively get them into recovery because, as we know, housing is critical to any form of recovery. And we should be addressing homelessness by giving people housing, not by taking them to the hospital for a short stay and sending them right back out to the lack of services and the situation that brought them in the first place. So some of the community services investments included clubhouses. So while the governor originally proposed 8.5 million for new clubhouses outside of New York City, this funding was dropped to 6 million. And while it's less than the original proposal, this will still allow the state to create at least 5 new clubhouses in areas outside of New York City. But this is where we really began to see the problems of the current economic situation in New York State, as well as the threat of cuts to programs like Medicaid and other services. So as the budget dragged out, the state and the governor's office decided to cut some programs with the anticipation that more funding will be cut later on. So, for instance, our Inset and Peer Bridger programs were originally slotted to receive a combined $4 million, but this was cut to just a combined $2 million, which was really disappointing, but we'll continue to work to ensure the implementation of these programs is effective so that we can go and ask for expansion. And as I mentioned, something I didn't include here was that because of these looming cuts, the budget also allows for the governor to make cuts to this year's budget by about $2 billion. She has to get approval from the legislature, but they made sure that they could make these cuts. And there's an expectation that if the current proposed cuts that are moving through Congress in DC are put into effect, that the legislature will have to come back in the fall to adjust the budget because we just can't make up for the shortfall of funding that the current proposals from Congress would create. We're looking at losing billions of dollars because of decisions made in DC. And we are also, as at the Alliance, we're also fighting this, and we'll be going down to DC next month to really ensure that the services are not cut and doesn't affect New York or any other state. Some other critical funding in the budget. We advocated for $15 million for ACT teams and got 14.6. We were happy with this addition because it provides more funding for teams that can do effective and intensive case management, and for a program that many people, thousands of people in New York, are on waiting lists for. There's also 4.3 million for transitional housing for court-involved individuals and 2.8 million for housing for individuals with serious mental illnesses and criminal histories. So some other investments that were included. We were incredibly disappointed by the state funding a new forensic state hospital on Ward's Island at $160 million. This prevents more funding going into the communities to stop institutionalization, but rather is focused more on institutionalization. And while this facility is meant for folks who have a criminal history and need their are considered to not be competent to stand trial, this facility is meant to help restore competency for folks. There's already a facility on Ward's Island, and this hospital won't be up for at least 5 years. So we really see this as a missed opportunity to provide this investment into community-based services that prevent hospitalization and criminal justice involvement in the first place. And it really shows how the state is moving in the wrong direction, going more towards institutionalization rather than away from it. And it also dwarfs the money that was meant for community-based services. As I mentioned before, some of the provisions that we talked about earlier only amount to less than about $30 million, whereas $160 million was spent on this state hospital that we won't even see for a number of years, but more importantly, that we don't need right now. So this shows how ineffective the funding has been for the services that matter and rather has gone to hospitals. There's also $119 million for other voluntary services, a host of them, including crisis beds, housing, peer centers, mobile crisis teams, family support, and more. We're trying to get more details on what services are included in this because the budget didn't make that quite clear. There's also 67 or about 68 million for education, care coordination, and supportive housing for adult home residents with mental illnesses. And we're trying to figure out how this money will be used so that we ensure that we're getting people out of adult homes rather than pushing people towards them. And lastly, there was 8.2 million for court-based mental health navigators. So what are our next steps? So now we are moving into the implementation phase of this budget. So the biggest things are really education, implementation, and litigation. So education about what services need to be funded going forward, but also how the services that were funded in this budget need to be implemented. which goes on to our implementation phase, really making sure that the way they're implemented is effective and that the right providers get these funding for these services so that they can provide them well and prevent more people from getting into institutions. And lastly, we're looking at possible litigation around the involuntary commitment expansion, as well as interactions of police with folks on the street. We want to use any tool possible to fight against this, and our legal advocate friends are considering what kind of litigation that they can do to ensure that this doesn't negatively affect the thousands of New Yorkers who rely on services and could be swept up off the street into involuntary commitment. So some of what we plan to do for going forward within our advocacy, we want to start earlier. So we want to identify member and other community priorities and begin our advocacy work in the late summer and early fall to inform our pre-budget discussions with the executive. Like I mentioned before, the executive holds most of the power when it comes to this negotiation. So if you're able to end up in an executive budget and change the way the executive sees how the budget goes, you're in a much better position than having to fight against the executive with the legislature, because they can only say yes, add a little bit, or say no to what the governor has proposed. So we want to make sure the governor proposes the right things going forward rather than more involuntary commitment and institutionalization. We're also pushing for more regional and local meetings with legislators so that we can develop better relationships with them and have them be strong allies in the legislature. We'll also be finalizing Alliance policy asks and training members and allied groups on how best to engage with legislators and generate media coverage via webinars and regional forums. We'll be working with you all and many other groups to ensure that the cross-disability space is strong, and folks know that if they make any changes or cuts, that we'll be coming to fight them as strongly as possible so they don't make those cuts in the first place. And then we really want to support our members and allies to develop year-round relationships with local legislators so that they are thinking about us whenever they're making decisions when we're not in the room. And thank you. That's really all I have for you. I know we have a couple of minutes. Maybe we can take a couple of questions. But if you have any more requests for information, you can see our website at rightsandrecovery.org or email me at lukes@rightsandrecovery.org.
Thank you, Luke. That was a lot of information. If
Yeah.
anyone that's on has questions, you can use the Q&A function to put them in. And while we just give folks a minute to do that, I had a good question for you, Luke. And I might have missed it if you said it, but when you talked about the incident review panels, I know you mentioned OMH having some responsibility in terms of reporting out and making recommendations, but do those panel review and discussions happen at the local level related to incidents, or is it a state effort even, related to local incidents?
It's a little bit of both. So the goal is to have the local providers, local mental health, the county providers as well, the county overseers, and then local agencies convene these so that it is a more localized response. But OMH would sit at the helm of this with Commissioner Ann Sullivan or one of her representatives sitting on the panel, and then they'll collect the data and provide those cumulative reports that we want to come out more than every 2 years.
Right. Got
One
it.
other, one other thing that I did also not include in here, but it was very much a budget issue, is the current fight around CDPAP. And, we have been strong allies to you all and other independent living advocates to ensure that CDPAP is saved and that people aren't harmed by these changes that the governor has made. And we really want to know what else we can be doing to support you all. We know that there are 2 bills that are currently working their way through the legislature and meet regularly with folks to discuss how we can be supportive and which bill is the better bill for us to be supportive
Yeah.
on.
We can touch base on that. And I know Harvey mentioned kind of getting together since he couldn't be here today to talk more about that. So
Yeah,
Yeah.
and then we also work with the MISC to really ensure that the new plan that will come out um, is in accordance with the Olmsted guidance and prevents more people from being institutionalized. So I think both of those are very much connected.
great. We
Great.
have
Thanks.
one question that I think
Yeah.
is good just for wrap up, Blaze. We have 2 minutes. The question is just, is there any advocacy work we can be doing right now?
Yeah, so we have sent. I think right now the focus has been on the federal budget to ensure that major cuts to Medicaid and other services don't affect New York. But we will have other ways to advocate for changes through legislative efforts in New York State now and then when the legislators come back in the fall. So we'll update you all. We'll be sending out emails on how you all can participate in those and support those efforts.
Awesome.
Great. Luke, thank you so much for this fantastic info. If you have any other questions that we just did not have time to get to, my email is in the chat. So zip them to me and I will gladly pass them on to Luke. And because we have to be done at 12, because the accommodations for interpreting and captioning. Two quick things. We've got a couple of webinars coming up next month. June 4th with the Office of New Americans and June 16th on social care networks. So keep an eye on your inbox for those announcements. And I'll have the recording for this webinar. And Luke, I meant to ask you, can we use these slides that
Yes.
Gotcha. Okay. I did not mean to put you on the spot there. I
Mhm.
just remembered to ask you. Um, all right. Fantastic. Well, with that, thank you all for being here and to my team here, Lindsay, Nicole, and Alex, and to our captioners and interpreter and Luke again for this fantastic presentation. And we'll see you in June.
Sure.
Thanks, Luke. Thank you so much.
Sure.